As early as the 1990s, we have been pushing for health institutions across the country to green their operations. That means to minimize the use of toxics in health facilities. It means looking at the waste that's generated and reducing our imposition on the environment.
I have worries about where the waste products from the hospitals are going.
Stale recirculated air, old buildings.
Some people have allergies to certain products and stuff.
The Canadian Nurse Association has introduced environmental health into the Nurses Code of Ethics. They have published background papers, they've had position statements, but nurses still were asking for more information in this area. So for the centennial year, it was decided to have a project on environmental health. The purpose of this project is to introduce concepts around environmental health into their practice, education, research, and policy, that this is part of what it is that all nurses do.
The amount of stuff I was throwing into the garbage just disturbed me. I was not happy about it.
The hospital industry and healthcare industry is such a huge industry, and with our preoccupations of infectious diseases, and especially since the problem of AIDS and hepatitis, etc., we're very conscious about keeping everything sterile and disposable, and so that means a very big amount of waste.
The hospital is a special place to be because you have all type of waste. You have biomedical waste, radioactivity. We have to address this situation very rapidly.
One of the initiatives that the Green Team has taken has to get the staff to buy into recycling. And our recycling has increased so much so that we've had to get new bins for the recycling, and we now know that we recycle more than any other hospital in Toronto.
We wanted to be a scent-free environment and mold-free and being mercury-free. And you know, and the list just goes on. It's just taking a look in your environment, in your workplace, and saying, what do I want to do first?
One of the reasons I'm so passionate about this is some of our babies are very, very tiny, and they have a lot of exposure to all of these toxins, whether it be phthalates in the PVCs or volatile organic compounds coming out of our cleaning, things leaching out of the incubator mattress. So if we could take away some of the toxic load that we're putting on them, maybe their outcomes could be a little bit better. Because when you read through some of the things that these toxins do, they decrease their neurodevelopmental outcome. And our kids are already at risk for a lower score on their neurodevelopmental testing. So if we can add 5 points to someone's IQ, that takes you from never being able to live away from your family to living independently, or from living independently to going to university. So I think we need to do what we can for these babies.
So what are we doing in our own lives to make a difference?
Okay, first they could stop driving, they could walk.
One of the things that I found is when I started changing my own habits, it really empowered me to help others make changes.
Recycling, bicycling.
Use less plastics for sure. Energy saver, light bulbs, just recycling.
Every little thing every individual does matters.
There's lots of little things you can do that will help.
And the fact that 100,000 diapers are being diverted every year, that all the polystyrene, maybe 1,000 cups a week, are now being recycled instead of going to landfill. That's something that I feel very happy about, and you know, that's a big thing for me. But even if I turn a light off instead of leaving it on, that helps. Every little bit helps.